Jake Ludington here at HP Discover, and I'm here with Reid Oakes to talk about the HP Tele Health Services Center, which is making medical care more accessible to people who live in areas where there may not be a hospital anywhere close at all, is what I understand.
Yeah, so when you think about areas that are really distributed, really rural, or even very high density urban places where you're looking at high density, you can't get access to the care that you need because of long treks or because of just inner city kinds of restrictions on where specialists and things like that are actually at. It really gives access to healthcare in those kinds of spaces.
So what kinds of results or outcomes are you seeing as a result of deploying these facilities?
One of the biggest challenges in all of these distributed areas is being able to get people access to just fundamental primary care. And what we're really doing with the infrastructure and being able to deploy this model around the Telehealth Service Center is really being able to provide that infrastructure that folks can have a teleconsult with their primary care physicians. So we're literally developing and delivering over 100,000 people worth of primary care right now in India. It's a great example of being able to connect folks back to real mainline hospital kinds of solutions or systems and the physicians and the specialists in those areas. So 100,000 patients connecting back for primary care is a pretty amazing thing.
So for these 100,000 people, what did their healthcare options look like before this was deployed?
Extremely limited. So when you think about India and health, for the most part, you have family health, you have herbal, what they call Ayush healthcare, and then you basically have a trek. You could basically go to get to primary or normal kind of hospital systems, but that trek could ultimately be outside of 6-12 hours to be able to get to a hospital system or to a primary healthcare system. So being able to actually cut that time down to be something local in village within range of where the patient can get to it within an hour, and being able to then interact with those specialists that they would never have access to.
And so what are the pieces that make up what HP is delivering as part of this?
Sure. So HP, at the end of the day, is building around an entire model, an entire infrastructure model of being able to bring together the infrastructure devices within the actual telehealth service center, which the implementation could be anywhere from an office building all the way through an individualized shipping container. Building the infrastructure to be able to have the telehealth consult, the connectivity, the infrastructure to bring that back, cloud implementation of electronic medical records, and then also the connectivity into the actual healthcare system, developing from a theater perspective, having the physicians or other specialists on the other end of the line to pick up the phone for telehealth. It's a total end-to-end solution, being able to actually deliver that healthcare in partnership with some of the best partners around the world on healthcare.
So the actual healthcare itself is run by, say, a hospital that's within the general vicinity of the community.
That's right. So when you think about healthcare, there's licensing issues, there's regulatory issues, things like that. So those are really things that, from the clinical delivery perspective, those guys are really good at. So and clearly that's not our play. We want to build the infrastructure to make that highly available, highly performant, and be able to kind of deliver that face on the other end of the wire in a way that's very meaningful for the patient.
So you're talking 100,000 people being served by this solution today. Is there a growth trajectory?
Yeah, so we're actually in partnership with a number of vendors in India and as well as other countries around the world. That number is growing from 100,000 today upwards of 200,000 by the end of the year, and even hockey stick and far beyond that next year.
Excellent. Well, I look forward to seeing that because certainly more people need better access to healthcare.
Absolutely. Changing the world of healthcare is I think, a really meaningful thing.
Thanks, Reid.
Thanks a lot, Jake.